Hello everyone, welcome to TalkingHealthWithDrLaz, your favorite health program on television. Reaching you from Nigeria's capital city, Abuja. My name is Dr. Laz Eze. Yes, in Nigeria, 2023 is a very significant year. It's an election year. A lot of issues are going to be discussed, and of course, campaigns started on 28 September 2022 for the presidential elections, as well as the National Assembly elections, which is holding in February 2023. Also within the month of October, the governorship and state assembly election campaigns is going to officially start. A lot of issues from security, from economy, and all of that, are topping the chart. But of course, with COVID-19 pandemic and a lot of, monkeypox and other diseases of public health importance still ravaging the global health space, and of course, Nigeria with its weak health system and the brain drain in the health sector also makes health a key topic and a key consideration for this election season. So on the program, we are going to be talking with a number of governorship candidates and of course, the presidential candidates at some point to discuss their health agenda. Health Agenda 2023, this is the maiden segment. I'll be hosting the governorship candidates and his deputy from Ebonyi State, Southeast Nigeria, on the platform of All Progressives Grand Alliance, APGA, or also called APGA. They'll be discussing what their health agenda is for Ebonyi people should they win the election in March 2023. I know you can't wait to get to hear from them. Of course, one of them is a health expert who has been on this program before, and the other is a professor of geophysics with deep knowledge in development and governance. You are going to enjoy this program. Do stay with us. You're going to see them after this break. Welcome back to Health Agenda 2023 on Talking Health with Dr. Laz. As you can see, I'm already seated with the governorship candidate of All Progressives Grand Alliance in Ebonyi State, Southeast Nigeria, Professor Benard Odoh. You're welcome to the program.
Thank you, Dr. Laz, for having us in your show. The pleasure is ours.
Thanks, Your Excellency. Professor Odoh, of course, as his title suggests, is a professor of geophysics at the Azikiwe University in Southeast Nigeria. He was also a secretary to the government of Ebonyi State from 2015 to 2018, and is a consultant to several local and international organizations. And of course, seated next to him is the first guest we had on this show, a health economist, a public health expert, Dr. Nkatawani Chukwu. You're welcome, sir.
Thank you very much, Dr. Laz, for having us on the show.
Yes, Dr. Nkatawani is the running mate, or of course, the deputy governorship candidate of All Progressives Grand Alliance, APGA, in Ebonyi State, Nigeria. And in the next 20 minutes or thereabouts, we'll be talking the health agenda they have for the people of Ebonyi State. Prof, Ebonyi State health indices, is not looking very good. You have less than 10 medical doctors in employment. You have one pharmacist in the employment of the government of Ebonyi State. Nurses, medical laboratory scientists, every cadre of healthcare workers are highly inadequate. The infrastructure, yes, in terms of buildings, the general hospitals are looking good from the outside, but largely empty on the inside. The tertiary hospital is the one that belongs to the federal government. A lot of people in Ebonyi State, to have serious intervention in their health sector or meeting their health needs, have to travel to Abakaliki from every point in the state. So looking at this, what do you intend to do if you win the March 2023 governorship election?
Okay, so once again, like I said at the beginning, we're delighted to be on this show. First of all, our understanding of governance is that the greatest asset of any society are society citizens. If we don't get our people prepared to become assets, then they will keep dying as liability the way they are doing today. So in Ebonyi, for today, the numbers you gave we are kind with the numbers. We actually have 6 medical doctors in a population of about 3.5 million people. The nurses are 17 in number, pharmacists just 1, no medical lab scientists as of today. We don't have medical rehab personnel, so we don't have medical record keepers, we don't have, name them. So the first thing we tend to do differently is, first of all, to ramp up a process that expands the human capacity involvement in the health sectors. The numbers today are grossly inadequate. Our people die on a daily basis because you have people traveling 2 hours to get to where we have the tertiary healthcare facility. This tertiary healthcare facility is already overstretched because, again, they have their own issues. It's funded by the federal government. They have space challenge, they have manpower crisis, they have all kinds of issues. So we need to get our primary healthcare facilities working quickly to avert the situation we find ourselves now. Our projection is that in our first 4 years, we should be able to recruit additional 50 health workers.
50 health workers or doctors or addition?
At least 50 doctors, but we intend to expand the entire workforce of the health sector, but at least 50 doctors in the first 4 years.
Okay.
This is our projection. If we do this, the implication is that every local government will have a minimum of 3 doctors to go around the primary health care facilities. We also intend to strengthen our partnership with donor agencies. What we have in Ebonyi today is that most of the partners that intervene in the health areas are not happy with the way the health sector has been abandoned. We don't have data now for many of our primary health care facilities. Without data, you can't get support. The intervention that can be tracked because you don't know whether there is performance based on what has been invested. So we want to build and solidify those collaborations and make our performance accountable and transparent so that more people can put in resources. 2, we may not be able to get all the people we require to get, but at the rural communities, we can train people that are lower the ladder to participate in providing the basic health knowledges that are required at the rural communities. We have 171 wards across the state. These 171 wards, people who have basic training schools, WAEC, can be deployed to provide basic health support. And now we'll have a center that can provide virtual support to those facilities from remote sources. So we intend to approach this differently. We don't want to leave our people to continue to die the way they're dying. Investment in hard infrastructure, they are good, but they're not as good as investment in soft component, the human person.
Right.
If we have qualified people working in health centers, they will be able to avert much of the crisis that we faced. In the last 7 years now, almost annually, we have an outbreak of Lassa fever in Ebonyi. And these are all things that can be averted if we have the right kind of personnel, the right kind of both training, the right kind of hygiene, the right kind of information that should be available at the rural communities. So these are the basic things we think we will approach differently. Our budgetary provision also must be in line with what is globally acceptable.
Right.
We want to benchmark our budget on the SDG goals. Global awareness is part of what we should and must be able to, hinge all our programs on. We don't want to run governance that is not anchored on anything. We want to run all our budgetary processes to anchor on SDG goals, so we can measure progress and now check whether the goals we set for ourselves, whether we are meeting those goals or whether we need to do some re-evaluation of our strategy and approach. So these are some of the key things we tend to do. And I'm also happy that I have someone who is vastly experienced in this area.
Right.
In terms of assessing global fund, in terms of providing the technical skill requirement to deal with these issues. So Ebonyi is lucky that we have, the kind of human critical resources that we need to drive a governance process that will reduce the current challenge we have in the health sector. This is, in a nutshell, what we intend to do differently when we emerge next year.
Thank you very much, Prof. I'll get to the health experts on the ticket. In fact, if you were to be in the university system, you'd probably also be a professor. So you mentioned some key things that struck. One is you said secondary school leavers, could be recruited to provide some kind of support within the health space, especially at the primary healthcare level of volunteers. Which kind of roles will such people be playing?
For instance, record keeping. Nobody has any health record now. Birth record and death record. We don't have record. Nobody knows how many people are born daily in Ebonyi.
Okay.
There is no such record now. We don't know how many people die daily in Ebonyi. So we cannot make a forecast. We cannot make projections.
Right.
In terms of population projection, how do you budget for people based on population that is emerging on a daily basis? So health record is one critical component that we think we can train people with basic education to understand what to do.
Okay.
Also, health information on hygiene, basic hygiene, basic what is it called again?
Health education.
Health education, basic health education, health promotion, sensitization, and all of that can be done by, you don't need high-tech people to provide those kind of services.
Right.
So anyone who has the background in science from secondary school, physics, chemistry, biology, mathematics, can basically fit into this lower level knowledge dissemination at the rural level. And it also creates opportunity for young people to participate in governance at that level. And now they feel sense of being part of the governance process.
Okay.
So that's the kind of thing we are envisaging to do with our young people. Even community leaders, teachers in primary schools, in the rural communities, can all get involved. The more people who can integrate into this ecosystem, the better result we can get from dealing with our health crisis at the rural level.
Right, sounds good. Finally, before we take a break, you talked about the budget, the benchmark, and using SDG as a key benchmark. So, what proportion of the health budgets do you intend to allocate to health? The Abuja Declaration of 2001 recommended 15%. Are you going to use that as a benchmark, or do you have something different?
Yes, absolutely. It's important that we take health. Like if you go, I don't know if you have read our documents for our first 4 and 8 years. Our agenda is a simple acronym, B shapes.
Right.
The B there stands for business environment. The S there stands for security. The H there is the health, which is what we're discussing now.
Yes.
Now, our cardinal focus in governance will be health of our people, education of our people, and now feeding. All of this done in an environment where people live in safety and decent environment. So the 15% is a minimum threshold, especially with the intervention fund that will come from different places. We're going to run open governance processes. People can access us and see what we're doing. So 15% for us is a modest budgetary provision for the health sector. It could be better than that as we progress, but that for us is a minimum benchmark.
Okay, thank you very much, Prof.
Thank you.
Yes, we are going to continue this conversation after the break. I've been speaking with Professor Benard Odoh, the governorship candidate of All Progressives Grand Alliance in Ebonyi State, Southeast Nigeria. And of course, part of the interview is his running mate, the deputy governorship candidate, who is going to be speaking more to us just after the break. Do stay with us. Welcome back to Health Agenda 2023, a segment on Talking Health with Dr. Laz on AIT. Yes, the first segment we talked extensively with the Professor Benard Odoh, the governorship candidate of All Progressives Grand Alliance APGA, Ebonyi State, Southeast Nigeria. And this second segment, I'll be speaking with the deputy governorship candidate, a health economist, in fact, one of the best in Africa, and also someone with extensive experience in health development and public health project implementation, having worked with a lot of local states, governments, international, donor, and non-governmental organizations. Dr. Nkata Chukwu. Yes, Prof had provided, he spoke about a lot of things on the health sector. Now, I'm not just speaking to you as a candidate, I'm also going to go deeper based on your background in this area. I read through the manifesto, and the first thing is to have a kind of strategic plan for health sector in the state. And I'm not surprised, having that as number one, given your background in this area. So what are you going to be looking at in that strategic plan?
Yeah, thank you very much, Doc. The popular adage that those who fail to plan to fail. So we want to be deliberate about how we tackle the challenges we have within the health sector in Ebonyi.
Right.
Like Prof had already mentioned, we know what the problems are, where the pain points are. But we want to be sure that we're systematic about solving this, because resources are not infinite, and there is also a time issue. Mm-hmm. And even if you have all the money, you will not find all the people and all the tools you need to solve this problem. So the plan is going to allow us to further dissect each of these problems, look at the root causes, identify solutions, cost them out,
right,
put some timelines, some responsibilities, and have a results matrix, so that what we're doing for every investment, every intervention in health, we can measure progress and basically be accountable to our people and to our partners who support us. So the plan is going to address each of the building blocks of the health system. Like Prof already mentioned, infrastructure. We have buildings, right, but building is just one tiny aspect of infrastructure. Do we have the right equipment, the right technology? This all comes into play. Now, human resource is a key challenge, and my principal Prof has already outlined some of our clear targets to make sure that we significantly ramp up the health workforce within the first 4 years, to make sure that we now have as close as possible to the minimum requirements for human resource within each LGA, so that we have doctors for our general hospitals. You can imagine with 6 doctors right now, 13 general hospitals. We basically have less than 0.5 of a doctor per LGA. But by the time we're ramping it up to 50 and more, we have 3 to 4 doctors per LGA, servicing the general hospital and also being able to support the primary healthcare centers. We're going to look at health management information system, which is critical because, like Prof mentioned, we can't tell you right now how many people visit our general hospitals in a day, in a week, in a month, talk less of the primary care facilities. So we're going to have a health information management system built on the already running National Health Management Information System, the DHIS and DHIS2, right? But actually making sure that we deploy this to all the levels. In each facility, there is a health records officer. And some of these graduates, we're saying these secondary school leavers we're going to bring in, will provide support, because it's not possible that in the first year or two we'll have enough money to have all the doctors we need, all the nurses we need, all the health records officers. So we will hire those cadres.
So these are more like ad hoc staff.
These are ad hoc support staff.
The professionals.
Exactly. And remember that these secondary school leavers at some point hopefully would either transition to universities or to learning a trade and all that. But in the interim, and the most important thing is, they bridge that gap between the health facility and the community. Right. This birth and death registration is important for us. And all that is going to loop into the facility health management information system, so that we know what is happening in our facilities. But even more importantly, we also know what is happening in the communities that are hosting these facilities. And we're also going to have in the plan, looking at how do we finance this entire thing, health financing. Our focus is really on ensuring that we have an operational health insurance or strategic purchasing arrangement for the state, where in the first 4 years, we have at least 20% of our population covered under a state health insurance scheme. Okay. And to do that, we're going to have a clear framework within that strategy, where we figure out for civil servants, what is government's contribution?
Right.
What do they contribute? For people who are in the organized private sector, how do we get money from them? For people who are in the informal sector, how do we get contributions for them or contribute on their behalf? For the poor and vulnerable, what do we do for them? And then the issue of the governance of the health sector. How is the health sector led from the commissioner level to the entire ministry, to the hospital management, to primary health care agency, to health insurance agency, down to the facilities? What is the relationship between all this and how is it governed? Because really without leadership, all these other things will fall. So the plan is going to really itemize each of these blocks, what the interventions are, the thoughts behind it, expected outcomes, and the timelines within which we expect to deliver this, and indicators that people can use people can track. And overall, our health management information system and strategic information system will help us to demonstrate results.
Thank you, Dr. Nkatachuku. Those plans really sound exciting. So now I want to ask you two questions. I will ask them together so that you could respond at the same time. So health as a business. A lot of times political actors and leaders see health more from the social perspective, more like humanitarian work, a place you put in money without getting it back. But there's a lot of business opportunities and economic potentials in health, and I know that you're experienced in this area. So what are you going to be doing, your administration, if elected next year in Ebonyi State, to explore this opportunity to ramp up the revenue of the state? Number two part is on emergencies. There's the public health emergency, the clinical aspect. What is the plan of the APGA tickets, ensuring that emergency services are available in the state?
Thank you once again. So we are very deliberate about our entire agenda for Ebonyi State, like Prof mentioned about the B shape. Across all the sectors, the priority sectors we've identified, we have embedded not just the social part, but the business part, because Ebonyi is not a rich state by any standard. So we're being very deliberate to make sure that for everything we're doing, we identify opportunities for each sector to become a net contributor to the Ebonyi economy, and not just the social sector. And that's the case for health. So for health, for instance, I mentioned the state health insurance program, which we're going to completely review and make operational so that what we're doing becomes strategic purchasing, using data to make sure that we deliver to people package of care that really solve their problems. And I also mentioned that we're going to be looking at how to get money. How do we build up the revenue for the insurance, right? Which would include government contribution by individuals, payment of premiums, right? Also contribution from partners, donors and all that, and exploring partnerships with the private sector. Now, when we have an insurance pool, what it helps us do is we're going to purchase services from both the public and the private sector. So it means that as we're getting our public facilities ready, we're encouraging private facilities or private entrepreneurs to set up facilities, health facilities, that we can also purchase services from. And when we have a pool, there is a bit of a guarantee, right? Now, the moment we take coverage up to our 10, 20% and beyond, the demand for health is going to go up, which means we're going to have opportunities to start partnering, and those are some of our areas of focus. We're manufacturing some of the key consumables that are used for health, not only in Ebonyi, the southeast region and all of Nigeria. Syringes, needles, IV sets, cotton wools. Nigeria does not manufacture face masks to qualities that are, where we export to other countries. We want to make Ebonyi a business-friendly environment for health entrepreneurs. We're going to be very deliberate as we link with education and the tech hub to also focus on health technology. People who are, innovating around healthcare and bringing them on board. So we're going to be running massive opportunities for entrepreneurship in health for our people. And on the emergency side, we're going to be deliberate about having basically taken from the national policy to adapt for Ebonyi, a policy that looks at integrated disease surveillance and response, and building up the surge capacity such that whenever this comes, just like what we've seen with Lagos. We're able to respond quickly and hopefully become a model for other states to copy. So we're going to plan for emergencies when there are no emergencies, so that when the emergencies we respond. Thank you very much.
That's a very exciting conversation with Professor Benard Odoh, governorship candidate of APGA in Ebonyi State, as well as his running mate, Dr. Katachukwu. So I just want to end this with just one more question to Prof. There is one thing that I've been seeing a lot on social media within active persons from Ebonyi State. They've been asking questions around the fate of Ebonyi State University and medical training in this institution, given that the teaching hospital that was built as a teaching hospital for the State University is now a University of Medical Sciences, which has been taken over by the federal government. Would the Prof.Odoh and Kata administration be building a new teaching hospital for Ebonyi State? If not, what plan do you have?
We will not build a new teaching hospital. It is not economically viable to do that. Under Governor Lechi, we had a teaching hospital that was donated by Lechi to Federal Minister of Health. Professor Odoh was the Minister of Health at that time. A new one recently was built in Nubru, again donated to the federal government. Part of what we intend to do is to review the ownership structure of these two establishments, make it more effective, more viable, so that it can serve our people and serve the need of the immediate community. That, I think, is the best approach in dealing with the issue of teaching hospital. It will still provide the training that is required to our people. We as states, we're going to sit down with federal government and say, okay, our fund was used to develop these facilities. How do we structure the ownership in such a way that it benefits both the host community and the federal government? I think when we do this effectively, we would have solved the challenge of going to do fresh teaching hospital, which, given the current situation now, it's not economically sensible to do that.
Right.
Yes.
Okay, so what's your last word for any Ebonyian that has watched this program up to this point?
Our last word is that, yes, over the last couple of years, our health has been in crisis. We're offering a message of hope, a message of a fresh beginning that comes with clear planning, clear intervention, and clear focus on what we intend to achieve with measurable milestones, which both we as the drivers of the process and those who will be part of the process will also see how transparent we are about it. So it's basically a message of hope to our people, that things will get better under us. And that, for us, is the key essence of governance, to improve the process and ensure that people get the best for their money and for their time. Now, this is our concluding statement. So we thank you for the opportunity to be here.
Thank you.
And we're grateful to you. Thank you very much.
Thank you very much, Professor Benard Odoh and Dr. Katachukwu. They are both the governorship and deputy governorship candidates, respectively, of All Progressive Grand Alliance in the Ebonyi State, Southeast Nigeria. And over the last minutes, we'll be discussing their health agenda for the people of Ebonyi State. The decision is for the electorates to make in March 2023. And our job is to continue to bring the candidates to share their health agenda to the citizens. Thank you for watching. My name is Dr. Laz Eze. See you same station, same time next week. Bye for now.